Picking on the next bone, which we'll get to talk about, its features. So features is more of like you trying to talk about the parts, and this is what is known as a frontal bone. So we're looking at the features or the parts of the frontal bone. So the frontal bone has some parts. We have the squamous part, we have the orbital part, we have the nasal part, we have the supraorbital foramen, the notch, and the frontal sinuses. This wants to be inside. What we have here is it serves as a forehead and the roof of the orbit, and also part of the anterior cranial fossa. So the squamous part, I think this one should be better off. So squamous part, we see that is a vertical portion that forms the forehead. It provides shape to the forehead and protection to the frontal lobe of the brain. And if there is a fracture there, it can affect the brain. They will have the orbital part, which is the horizontal portion forming the roof of the orbit and part of the anterior cranial fossa. Supports the frontal lobe and separates them from the orbit. Okay. Then we have the nasal part. That's the one that is coming towards the nose. It's a small portion and it articulates with the nasal bones and the maxilla, contributes to the formation of the nasal bridge. And traumas there could actually affect the nasal structure, that's the nose, and the airways. Then supraorbital foramen has a notch, is above the orbit on each side. This one, the one that is like the roof of the eye. So it also transmits the supraorbital nerve and the vessels, so you have to be careful. Then we'll have the frontal sinuses, which is within the frontal bone above the nasal cavity. It lightens the skull, produces mucus, and also contributes to how your voice will sound like. So it's a site of frontal sinusitis, which can spread to the orbit or brain if left untreated.